I'm one of the medical oncologists at the Seattle Cancer Care Alliance, and I know some of you in this room, or many of you in this room. And I'm going to be talking to you for 15 minutes about the TIL therapy program at the Hutch. And this is a program that over the past several years I've been building with Dr. Bird and several others. And it's near and dear to my heart. But TIL stands for tumor infiltrating lymphocytes. And this picture shows in orange, that's a little T cell that's trying to attack a cancer cell. And so since many of us are far from our last biology class in school, and it can be hard to remember what these things we're talking about, I'm going to just review what the cells are. So our blood is made in our bone marrow, in our bones. And your doctor, like for the patients in the room, your doctors are often looking at your red blood cells, your white blood cells, and your platelets when they get a blood draw. Your red blood cells carry oxygen to different parts of your body. If you're low on those, you become anemic. Your platelets help your blood to clot, and your white blood cells fight infection. And melanoma patients are increasingly hearing more and more about these lymphocytes and these T cells. So lymphocytes are one of the types of white blood cells. So you have neutrophils, macrophages, monocytes, and they all do different things. And the lymphocytes are one of those cells. And among the lymphocytes, you have different types. So you have B cells and T cells. And the T cells are what we usually talk about are the main cancer-fighting cells. But there are several different types of T cells. There are cytotoxic T cells, T helper cells, T regulatory cells. And the interesting thing that we know about the immune system is that there's a duality in your immune system. There are some immune responses that promote cancer, actually, and there's some that suppress and fight cancer. So this is a melanoma patient. We know that melanoma is a special cancer. It's one of the most immunogenic cancers of all cancers. And what I mean by immunogenic is that it's one of the cancers that can be recognized and fought by your immune system. And there are case reports of some melanoma patients who didn't have any treatment and their melanoma resolved on its own without doing anything. That doesn't happen very often, so I encourage no one to not get treatment. But this seems to happen in melanoma more than other cancers. And so this is a patient who hadn't gotten any treatment, and this is her melanoma lesion on her skin, and it's starting to resolve in the middle. And her doctors biopsied this, and here you see, I can't get the, I don't think the cursor's working, but, oh, here, okay. Here, so this is where the melanoma is disappearing, and this is where the melanoma is still present. And when you look, when you stain this tissue for T cells, you see that the T cells are exactly, they're going into the place where the melanoma is disappearing, and they aren't yet going into the place where the melanoma is still present. And somehow it's these T cells that are mediating, they're causing this disappearance of the melanoma. And we do see in the melanoma clinic about 5% of the patients who come to us actually have something called melanoma of unknown primary, where the melanoma, they're diagnosed because the melanoma appeared inside in one of their organs, but they never had melanoma of their skin. And what we think is going on with the majority of these patients is that they did have melanoma of their skin, but it disappeared. And the reason it disappeared and they never detected it is because they had an active immune system that made it go away. And so T cell therapy has to do with trying to harness the power of these T cells and take advantage of that to fight the melanoma. And so one of the questions is, when you hear all about how great T cells are in fighting cancer and melanoma, is why doesn't all cancer disappear due to your T cells? And there's several reasons for this, and just to simplify some of the main reasons that we think this happens is because there simply aren't enough of the cancer-fighting T cells in a patient. Often we find these cancer-fighting T cells are not functioning right. They're exhausted, or they're being suppressed by the cancer, which sets up this suppressive environment in your body. Or the T cells can't get to all the places that they need to go. And so the strategy, and so this little drawing, the red cell seems to be the single cancer-fighting cell in this bunch of like all these other T cells. And so the strategy of T cell therapy is to try to find these cancer-fighting T cells in the patient, take them away outside of the patient's body, take them into the laboratory, and activate them, expand them, grow them, select which ones fight the cancer the best, and then grow them out into the millions and billions in some cases, and then infuse them back into the patient to do their job. And so for TIL therapy, the way this works is we have a patient who has a tumor, and Dr. Bird or another surgeon takes them to the operating room and removes that tumor. And then some of that goes to pathology, but some of that, if they're on our trial, comes to us. So we have someone who goes to the OR and collects the tumor and brings it to our lab. And then we cut it up into little fragments and put it into these plates where we give it a lot of food to help the T cells grow. And then we grow them for anywhere between 2 and 5 weeks, and then we test them. And we test them against the patient's original tumor. So we've saved part of that tumor at the same time that they had surgery, and we've frozen it down. And so we thaw it, and then we test these T cells against their tumor and see which ones have the best ability to recognize their tumor and to fight that tumor. And then we select those best cells, and we grow those out into the billions to infuse back into the patient. So the next slide, if you're squeamish about seeing tissue, you can look away for a few minutes. But this is one of the patients the tissue from one of the patients who enrolled on our protocol. And so the patient had, I think this was a lymph node mass that Dr. Bird removed, and we got the extra tissue that otherwise would not have been used, would have been discarded. And then we brought it to our lab. And then you can see it gets divided up into these little fragments and then put into this plate. And our cell processing facility is actually in this building. It's down one floor, and it's just right over there. And it's actually more sterile than an operating room. You have to go into this room that's positive pressure, so it's blowing out all the germs from the room. And then you have to gown up in multiple layers. And then these lab technicians go in, and they grow the cells. And so TIL therapy is not for the faint of heart. It's a pretty aggressive treatment. It requires 7 days of chemotherapy before you get the TIL. And then you go to the hospital and get the TIL infused into you by vein. And then it's followed by high-dose IL-2. And so the reason the chemotherapy is given is not because the chemotherapy is actually fighting the cancer, but because we understand with T-cell therapy that you need to prepare a patient's body to receive these T cells. If you try to give the T cells into someone who hasn't gotten chemotherapy, so this is a drawing of someone with all these other immune cells in their body, and the cancer sort of upregulates those immune suppressing cells in your body, and you try to infuse these T cells, they don't really do that much. They go in and they don't travel to where they need to go. They don't really grow and expand. But if you give them chemotherapy first and you wipe out this bad immune environment in the patient's body, and then you give the T cells, they go in, and then they can go, and they can expand, and then they can grow. And so part of the benefit of this chemotherapy is it creates the space for the T cells. It also decreases competition. You have a normal level of food for the T cells in your body, and by wiping out all these other bad immune cells you don't want, you have more food available to give to the T cells. It gets rid of the bad immune suppressing cells itself. And then we think that there's something about when they go in after someone has chemotherapy to have all the space, the T cells start dividing rapidly and making copies of themselves. And that active production and generation and expansion causes them to change a little bit after they're in the patient's body, where they are able to take on a younger, sort of a younger body, where they're able to survive longer and last longer in the body. And so this is a video of a T cell attacking a cancer cell. And it's, yeah. And I love that you see the T cells are underdog. It's this tiny little guy, trying to go after this T cell, and it keeps going at it, and it gets the T cell to sort of explode on itself. So far, we have enrolled 30 patients on our TIL protocol for TIL generation, and we're about 60% successful in generating cells from patients' tumors. And we've actually treated 7 patients. This is one of the patients we treated. I think her parents are in the room. But she had been on several different clinical trials and immunotherapies to this point. And she had a nodule on her head. And she, I don't know if anyone knows Call of Duty, this video game. I didn't either. I'm too old, but she played this video game that required a headset. And a few weeks after she got the TIL, she said, I know it's working because the headset doesn't rub against this mass on my head anymore. And 15 weeks later, that little nodule, which you see like this sort of white, little nodule has disappeared. And the radiologist who was reading the scan hadn't read her medical record, so he didn't know what had happened. And he wrote in his report, the patient has undergone interval surgical resection of her mass, which I was pretty excited to see. We always try to succeed the way the surgeons do. And that's actually our goal. You know, a lot of people ask, when they have stage 4 melanoma, can we do surgery and keep removing these? And we would if we could, because we know that surgery works, but when you have stage 4 melanoma, you can't just keep removing these different masses. But if we can find a treatment that works just as well as surgery and sort of resecting, getting rid of this tumor, even though there are several different tumors, then that's what we're going for. This is another patient who you'll hear from later on in the patient panel, who had also had multiple surgeries. The melanoma kept coming back. And he had also been on an immunotherapy, and the melanoma kept coming back. And this is a scan, just to orient you. This is what we're looking at is something, a mass underneath the chin. So this is the back of the head, and this is the front, the jawbone. And within a few weeks of getting the TIL, we watched together. He would come in, and I would see him, and we would watch together, and we'd feel this mass, and we felt it shrinking away. And he is one of our 2 patients who had a complete response to TIL therapy. And here at 24 weeks, you see that it's completely gone away. And I think we have both of our patients who had a complete response are here today, and maybe can share you their stories. But it's something that's really gratifying and keeps us going. And so future directions for TIL, finding ways to make TIL more powerful, making it more cost-effective, because it's pretty expensive to take each person's tumor, grow it in the lab, grow these cells. We want to find a way to make this less expensive so we can offer it to more people. Combining it with other promising treatments and figuring out the best order of treatment. So we have a lot of exciting treatments for melanoma that you are all probably aware of, and finding how does TIL fit in, like when should you give it or when should you try it with these other treatments. And then one thing that we're actively working on is trying to develop TIL therapy for other cancer types. And so none of this would be possible, none of anything that you hear about today would be possible without patients who are willing to take a leap of faith during a very difficult time in their lives to participate on clinical trials. And so this is what, patients like you are what makes this possible, and you're also the reason that we do this. So thank you very much.